Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is the non-operative treatment of adult scoliosis. Adult scoliosis involves rotation and curvature of the spine due to degeneration of either the disc or the facet joints in the back of the spine. It's very different than pediatric scoliosis. It's often painful, as opposed to pediatric scoliosis, which is usually not painful. It's stiff, therefore it's not responsive to bracing, and it often leads to both back and leg pain. Well, why does it occur? There are two potential reasons for why adult scoliosis occurs. One is if you had pediatric scoliosis and then you got skeletally mature and it's over 40 degrees, then usually it gets worse at about 1 degree per year. So it doesn't sound like a lot, but let's say you're 20 years old and your curve is 40. Then let's say you get to the age of 60 or 70 and it's 1 degree per year, you'll end up at 90 degrees for a curve. That's pretty significant, okay? So it adds up on you. Or it may be that you had no scoliosis as a child, but you develop as an adult, and it all starts with degeneration of this intervertebral disc, okay? So the disc starts to degenerate, it shifts abnormal stresses to the back of the spine, developing arthritis in the facet joints, and it's not symmetric, so you can start to get more on one side than the other, and you can end up with a curve. And when that happens, nerves can also get pinched as they're trying to get out from the spine, and that's called spinal stenosis. So what are the symptoms of adult scoliosis? Well, the arthritis from the facet degeneration in the disc leads to significant back pain. Patients may also get muscle weakness and aching and difficulty standing up straight. A person may also have buttock and leg pain from the nerves getting pinched, which is called spinal stenosis. Now, the vast majority of patients can be treated without surgery for adult scoliosis. Over-the-counter medications can help for mild to moderate pain. This may include anti-inflammatories, Tylenol. When you get into prescription medications, you may end up with higher strength anti-inflammatories or Celebrex. Neuropathic medications, narcotics, topical prescription pain creams can help. Physical therapy, interventional treatments, which we'll talk about in a moment. Here we go. So facet injections, such as you see a needle here going right into a facet joint, that can put numbing medicine and steroid right into the painful joint, or joints. Multiple can be injected at one time. The steroid can stick around and provide pain relief for weeks to months. Trigger point injections, which go more back here in the subcutaneous tissue, can help a lot with relieving muscle spasms. Additional treatments, a medial branch block, you can see up here. Here's the spine coming down, okay, all the way to the sacrum. The joints on either side are called the facet joints, and here numbing medicine is placed around the joint, not in it, and it stops transmission of pain signals through these little nerve endings called the medial branches. All right. Now, if that works and then wears off, a radiofrequency ablation procedure can be performed, which you can see here. Catheter comes into the same area, it heats up and deadens those nerve endings, and that can provide pain relief for 6 months up to 24 months. Additional treatment may be an epidural injection. This is when soothing steroid medication is placed around nerve roots that are getting pinched, such as with spinal stenosis. Over 90% of those with adult scoliosis can achieve a satisfactory level of baseline pain without surgery. Between the treatments for back and leg pain, most people do not end up needing surgery. Surgery is elective, it's quality of life, it should be a last resort. It does have a high complication rate, over 50%. Usually surgery involves both decompressing the pinched nerves and stabilizing it with a lot of hardware. Adults just don't tolerate these types of procedures as well as pediatric patients. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.